Of exam we're going to talk about is when the patient comes in and they're either a new patient or they're here for their yearly exam. So we call that a comprehensive eye exam. And you're going to have this white form here. And the first thing that you're going to start off with when you do case history, there's a couple different ways you can do it. Some people will start on the inside with the medical history, which is fine if you want to start there and then come back to the eye history. But I'm going to start today with the eye history. So basically you just want to start in this column. Just make sure every blank is filled out, every question is asked or verified if it's a patient who's established, and then just make sure that everything is complete. So the way I start is by asking the patient the date of their last eye exam. So if that's a new patient, you want to ask if they've ever had an eye exam before. If they don't remember the exact date, that's fine. You can just get an estimate. Was it a year ago, 5 years ago, 10 years ago, or maybe never? And then it also has the name of the doctor. If they know that, that's great. If not, you can just generally get an idea of where that exam took place. If it is an established patient, you want to make sure that the patient has not seen another doctor in between visits. So if you look back in the chart and you see that they were seen last year, you just want to confirm that with the patient. Like, say you were seen, your last eye exam was here last year, correct? And just have them confirm that for you. The name of the doctor you can fill in if you know who the doctor was last time. If you're not sure, you can fill in WEC for Westminster Eye Care, just meaning that the eye exam was here. Another scenario might be they might have seen a specialist for the eyes, and if that's the case, then you want to make sure that you record that and the name of the doctor that they saw. The next question, do you wear glasses? That might be information if it's a new patient. Obviously, if they have glasses on, they're wearing glasses, or it could be that they have glasses with them. So you want to ask if they wear glasses. If it's an established patient, you might be able to tell from the previous exam that they wear glasses, and you just want to say, oh, you wear glasses, correct? And ask them what they wear the glasses for. Do they wear them all the time? Do they wear them just for distance? Do they wear them for reading, or do they wear them for both? The following question is about activities that they do during the day and in their free time. So you just want to ask the patient, what do you do during the day? Do you work? And record what type of job they have. So try to get at if they're using their eyes a lot in their job, if it's a patient who works on the computer all day, if it's a patient who works with jewelry or something small, where they have a different kind of visual demand from just the average patient. And then you can also ask them what they do in their free time, again, getting at how much maybe reading, computer use, electronics, especially for kids, you know, if they use a lot of electronics or video games, that's good to know. Basically how they're using their eyes during the day and in their free time. The bottom question is, do you wear contact lenses? So if that's a new patient, you're going to want to ask that question and record if they wear contacts and if they know the brand or the type of lens that they're wearing. If it's an established patient and you see that there are no blue sheets in the folder, meaning that there's no contact lens evaluations or fits that have been done, then you just want to confirm that with the patient and say, you don't wear contact lenses, correct? And the reason we do that is because some patients will actually, even though they've never been fit for contact lenses here in the office, they could have gotten contact lenses either online or from a friend or some other scenario. So you want to just make sure that they are not wearing contact lenses, because even though they weren't fit here, doesn't mean that they're not wearing them from some other place. So the following area that we're going to talk about is the chief complaint or the reason for visit. Okay, so what you want to do when you're starting this section is to just ask the patient, what brings you in today? Are you having any problems with your eyes or your vision? And then just let them answer the question. Don't give them any suggestions. Don't say, are you having any itching or burning at this point? We just want to find out what brought them in to have their eyes examined today. So that could be, I'm having problems with my glasses. My doctor told me to come in because I have diabetes. I'm having some redness, some pain, some irritation. So just ask the patient what brought them in, and you can go ahead and record that. If they have no reason, say they just said, oh, well, it's just my annual appointment, or I just came in to get my eyes checked, then you can proceed with asking them some questions about their eyes and if they're having any symptoms. Some good ones to ask are, well, you're having any burning, redness, itching, tearing, any flashing lights, floating spots, or any general problems with the eyes or vision. And if that's the case, you can go ahead and proceed with the questioning for that. So when we're going through the questions here, so your chief complaint would be what the patient is complaining about. So for an example, let's say that they're complaining of redness in the eyes. Your next question is on this list here is about the location. So when we're talking about eyes, the location is typically, is it the right eye, or the left eye, or is it in both eyes? Another scenario that I can think of is maybe if the patient's complaining of headaches, the location would be kind of where on the head is the headache. Is it more of a frontal? Is it a temporal? Is it all over? Is it in the back? So get an idea of typically which eye or both eyes that the problem is in. The next question is relief, which means are you taking anything to make the eyes feel better? So if they're, again, let's go back to our example of redness. Are you using anything for the redness? Are you using any eye drops, or does anything make the eyes feel better? If they say, oh yes, I bought some drops in the store, try to get an idea of what those drops are if you can. Maybe they brought them with them and you can write down the name of the drop. You want to write down how many times a day they're using it, in which eye, and if it's helping at all. So if they do say, yes, I bought some Visine, I'm using it about twice a day in both eyes, but it's not helping and it's not making the eyes feel better, that would be information you would want to fill into that section. As far as severity, you just want to get an idea of how bad that problem is. Is it, you can either go with like a mild, moderate, severe type of question, or if it's easier to say on a scale of 1 to 10, with 10 being the worst, how bad would you say this redness is, so that you can give them an idea that way. Duration is how long within a day that problem is lasting. So when you think of duration, it's kind of within a day. So what I usually say is, how long is the redness lasting? Does it last for a few seconds, a few hours? Or does it last all day long? So give them some choices as far as that goes. Or if they're complaining about burning or stinging, do your eyes burn all day long, or does it just last for a few seconds, a few minutes, or a few hours? And then the one underneath that is frequency. And frequency is how frequently it's happening or how often it's happening. So if we go back to the redness example, how often are your eyes red? Are they red every day? Couple times a week, a couple times a month, a couple times a year, so you can get an idea of how often it's happening. Because obviously if you have someone who has a certain symptom, let's say burning, if they're having that all day, every day, and it's been going on for a while, that's very different than getting burning that lasts for a couple seconds and it only happens a couple times a month. So you want to get an idea of how often and how frequent this is happening. The onset would be when the problem first started. So you can tell them with the redness, when did the eyes first start to become red? Like, how long has this problem been going on for? Has it been happening for a few weeks, a few months, a few years? And the final question here is association. Association is sometimes a tricky one, and it doesn't always pertain to every symptom. But if you can get an idea of if something is causing this problem to happen, or if they associate this problem with something. So if they say my eyes are red, and they're red every time I go outside, or they're red every time I use the computer. So if there's something that's associated with that problem or causing that problem to happen, that would be an association. Another thing that you can fill in for the section, if the patient is not having any type of complaints, you can fill out what's called a reason for visit. A reason for visit is someone is coming in for an eye exam for a particular reason. And for us, the main ones that you want to look out for is for diabetes, because if the patient has diabetes, they have to have an eye exam every year. So that would be a reason for visit. If a patient has glaucoma, they're a glaucoma suspect, they have cataracts, any type of medical reason like that, those are reasons for visit. So that means the patient has to come in to have those things evaluated. So we'll just take a scenario of diabetes. If a patient has diabetes, the way I would fill this out is I would have diabetes, here's the reason for visit. Location would be systemic. Relief would be either oral or insulin, depending on what medication they're using. And in this area, you could also put diet controlled as well, if they're controlled by diet. For severity, you want to put either they're controlled, uncontrolled, or questionable control, depending on their glucose levels. Duration, they have diabetes all day, and then frequency would be every day because you either have it or you don't. It doesn't come and go. Onset would be for how many years they've had diabetes. And the association in the situation, you can leave that blank. But that's just generally how you fill out for diabetes, because that's a pretty common one that you'll see. Then you want to proceed with the rest of the questions as far as their past ocular history, any history of glaucoma, cataracts, macular degeneration, or any eye surgery. If the patient says they have had surgery of the eyes, you want to make sure that you note what type of surgery they had, what eye it was on, and when it was done, if the patient remembers. And the final question is just a family ocular history of glaucoma. So does anyone in your family have glaucoma? If they say a common follow-up question to that is, what is glaucoma? And in that situation, we just want you to say that glaucoma is an eye disease that obviously affects the eyes, and it's usually treated with eye drops. Patients often get that confused with cataracts. So just make sure that they say, oh, it's glaucoma, not cataracts. And then when you're done with that section, you're going to open it up to the medical history. And here, if it is a new patient, the patient is given this form to fill out, and they should have filled it out before they came to see you. If that's the case, then you basically just want to copy over that information. You want to double check and just say, did you have a chance to fill this in completely? Is this information all correct? And if they say yes, then you just go ahead and transfer that information over to the exam sheet. If it is an established patient, then you will very typically have this full medical history filled out for you from the year before. So let's take those two scenarios. Let's say a new patient, but maybe they didn't have a chance to fill out the form. So we're just going to go through that quickly. You're just going to ask them their primary care physician's name. If they don't know the name, they can just give you the location. So if it was at a particular health center or a particular office, you can just fill that information in there. Try to get a doctor's name if they know it. And you want the date of the last visit. The month and the year would be great. If they really can't remember when it was, but they knew it was last year, then you can just put the year that it took place in. Then you want to basically go through your review of systems, which is just quickly asking the patient what medical conditions that they have. So I'm going to use this, just go through here and hit the bold topics with maybe a couple of the more common ones in there. So the way I would do this, and this is again, if it is a new patient that did not have the form filled out for some reason, then you're going to start with do you have a history of any allergic or immune disease, like any environmental allergies? Do you have a history of heart disease, like high blood pressure, or have you had a history of a stroke? Cholesterol you could throw in there as well, because that's another common one. Then for general illness, I usually say, have you had any significant illnesses recently? Any significant weight loss or fever? Any history of diabetes or thyroid disease? And then if they do have diabetes, you want to make sure that you check off if it's type 1 or type 2, how many years they've had it. And then the follow-up questions with diabetes, you want to ask them their glucose levels, their most recent glucose levels, which is typically on the day of the exam, because most patients do check it every day. So you can fill that number in, and say they told you that was taken 2 days ago, then you want to record when the test was done. And then also ask them if they know their hemoglobin A1C level. And that's another one that they'll usually ask you, what is that? And that's a blood test that's done for diabetes. And it's typically a number between anywhere from 5 to usually 8, 9, or 10. So you want to fill in that number if they know it. The next section, do you have any sexually transmitted diseases? Any blood diseases or cancer, like anemia? Any psychiatric diseases like depression or anxiety, any bone muscle disease like arthritis, any neurological diseases, any respiratory diseases like asthma. Okay, and then you just continue with the bottom. If it's a woman that's of childbearing age, then you want to ask, is there any chance you could be pregnant, is the way you want to word that. And if yes, you check it off in the number of months, number of children. And then down here, you just want to check off that the review of systems was taken today with your initials. This is if you're reviewing from a different day, okay, which we're taking it today. So again, if it's a new patient, that's a full history. You shouldn't really have to be doing that too frequently because you should have the form filled out. The next scenario is if it's a patient who is an established patient, meaning they were here last year, they were taken a full medical history last year. You basically want to confirm whether or not there's been any changes. So what you would do is you would take out their previous medical history to compare to this year, or ask them first, has there been any changes to your medical history since last year? And if they say no, then you want to just go through last year's medical history and see what conditions they had last year and just confirm that they still, are current and going on currently. So you would say, oh, I see here last year you had a history of high blood pressure, correct? Yes, and so you would check that down. I see here you have a history of diabetes, correct? Yes, and you check those off. So go through the history and any positive medical conditions, you want to record them over onto the more recent exam form. Then at the end of that, after you've gone through and confirmed all of that, you want to check with the patient, are there any other conditions going on or any other medical problems that you currently have? And they should say no. If they say, oh yes, I was just diagnosed with X, Y, or Z, then you obviously fill that in. The next section that you go to is systemic medications. So for a new patient, you would want to ask them, are you on any medications? You want to try to get the name of the medication, the dose, and how often they take it, whether it's once a day, twice a day, 4 times a day. If it's an established patient, you should have that list from last year. So you're just going to go to the list of medications and say, I see last year you were on X medication. Are you still taking that? Yes. Now I see you're on Y medication. Are you still taking that? Yes. And you're just going to move that information over to the more recent exam. Once you get to the bottom of that and you've confirmed all of their medications, whether they're still taking them or not, then you follow that up with, are there any other medications that you're currently taking? And just make sure that there's not something else that wasn't on that list. Then you want to go to ocular medications. Are you using any eye drops? If they are using eye drops, you want to write down the name, the dose or the frequency that they're using it. So are they using it once a day, twice a day, 3 times a day? And then which eye, OD, OS, or OU? And then obviously if they have any allergies, in particular any allergies to medications in this section. Okay, so once you're done with that, you're going to come over to the exam form. Just to finish up the exam form, you want to make sure that you fill in their current prescription here in this section. So this is whatever pair of glasses that they are currently wearing. So oftentimes they are glasses that were purchased from us. And if that's the case, you just want to verify with the prescription that's in the chart. So you want to ask them, are these glasses from last year? If you see an order form from last year, and then you can copy over that prescription. They might say, no, I lost those glasses. I'm wearing the ones from 3 years ago. Then you want to go back in the chart, find that order form, and that's what you're going to fill in here. If they have a pair of glasses and you're unsure of either maybe they got them somewhere else or it's not clear what pair of glasses they are from in the chart, then you want to do lensometry on those glasses to get the exact prescription that's up here. As far as the information in this section, what you want to fill in is the distance prescription here. You want to make sure that you fill in the ad in this section if they have one. And then the other piece of information you want here is what type of lenses they are wearing. Is this a DVO, an NVO, a bifocal, or a progressive? And having the year that the glasses were made is very helpful as well. You should be, before you leave the room, you want to make sure that you have the last manifest prescription in the phoropter. So that would be the most recent prescription that was done prior to today. Oftentimes that is on the last exam form from a year ago, but if the patient has come in for either a follow-up or a post-op visit, you might find a manifest prescription on there as well, and that's what you should be putting in the phoropter. One other thing I'll mention, is the infant visual history, which is down here in the bottom. This should be completed on anyone ages 5 and under. And these are just questions about development and birth, just to make sure that there were no significant complications. Oftentimes the patient or the patient's parent might not remember these specific dates. And those things are okay. You just want to know, was everything normal or abnormal? So that should be filled in for anyone ages 5 and younger.